Hello and welcome to Visionary Walks at I Want Second Opinion. Today we have got Dr. Soumya Lanka. She works at Skin Sense GP Clinic at Chelmsford. She specializes in skincare, hair care, and female health. She is no new face to us. She has been with us in the past on two specific topics. One is skincare, other is hair care, Soumya. Yeah?
Yes, that's right.
Thanks for Yeah, okay. She gave us some beautiful insights on those particular topics, and it was well received by our public. Today, the topic of discussion is on female health, and in specific, menopause. We are going to do this three-part series as we discuss. Yeah. The first one is on menopause as it is. Second one is on the hot symptom of hot flushes,
Yeah.
and the third one, HRT in menopause and in hot flushes that we can do specifically. Now, let's jump into the topic, Soumya. Menopause as it is. Uh, could you please tell to the audience what exactly menopause is and at what age does it typically occur?
Right. So when you say menopause, it's a very broad term basically. So most of them will say you're postmenopausal after the age of, not age, after you've had any periods for the last 12 months or a year. So that
Okay.
means you are postmenopausal. Okay. So menopause is a long period which includes perimenopause, menopause itself, and postmenopause. Okay. So that's the whole way how we can manage the menopause.
Okay.
So the average age in UK is about 51. So I would say so that's the around the age of 51 that most of them go through menopause. Yeah.
Okay. Does you told in UK, which means does it mean that in different countries it varies differently?
Yes, it does because obviously with women, there's a familial pattern. So you need to find out from your parents, from your mother, from your sisters when they went through the menopause. So
Okay.
usually you will tend to have a pattern in the family. Yeah, it
All
differs.
right. All right. Okay. So, what are the common symptoms of both menopause? You told that there are three phases, the menopause and perimenopause. What are the symptoms? Like, how do people come to know that they are undergoing this?
It's very hard because there's a lot of intermix of other problems and diseases that kind of fall into the category of perimenopause as well. So most of them will present with it can present with varied symptoms: anxiety. You can have hot flushes, hair loss, dryness all over the body, loss of libido. You can have joint pains, aching all over, and you can just be even mood swings, slight mood swings, and a lot of stress and anxiety. And some people cannot even work with these symptoms. So that's
All right.
when you treat the
Okay.
symptoms.
Okay. So, which means that in that particular age group of population, if they are expecting any kind of an uncommon symptom, it may be in the perimenopausal or the menopausal one. Yeah.
Yes, it can be, yes. But then again, there's no age group wherein the perimenopause can start. So it can start
Okay.
as early as even 35 and even in 40s as well. 40s is very common, but as early as 35 as well. But these are classed as, you need to, make sure it's definitely menopause and there's nothing else which is contributing to the symptoms. Yeah.
Fantastic. So in that case, how does perimenopause differ from menopause in that case?
Okay, there's something called as premature menopause,
Mhm.
perimenopause, menopause. So premature menopause is anybody less than 45. They need to
Okay.
be examined. They need to have ultrasound scan to make sure everything is okay in the area and that there's nothing else causing these symptoms. So when you come to perimenopause, again, noticing these symptoms and consulting a specialist is more important, wherein
Okay.
wherein they can do further investigations, either it's a blood test or whether it's an ultrasound scan, and whether it's a symptom of perimenopause or menopause at all in the first place, because
Okay.
you can have thyroid problems and there's lots of other conditions which mimic these conditions. Yeah.
Right. Okay. So if that is going to be the case, can menopause happen for any other reasons apart from aging at all?
Yes, it can. It can happen because if you're a person who is getting stressed constantly, you're gonna, end up in problems much more quicker. That's like, any organ in the body wears off quicker. So as your ovaries as well. So you can fall into the premature menopause category, even if you're not at that particular age. So stress is
Right.
a very, very important factor. And there's certain hormones, there's certain medications that we take which pushes you into the menopause very quickly as well.
Right. Okay. So if that is going to be the case, is menopause a clinical diagnosis or do you need any confirmatory evidence? You told about ultrasound scan and some blood tests. Do we
Yes.
need to?
No, you don't have to have an ultrasound or an investigation. It's mainly a
Okay.
clinical diagnosis. It's based on the symptoms. But in
Yeah.
certain cases, you want to make sure there's nothing else contributing to it. Because if it doesn't improve on putting you back on the HRT or anything, then that means it's not related to menopause. So there might
Uh,
be other things causing.
all right. Okay. So if that's going to be the case, how long can the menopausal symptom last and how do they evolve over a period of time?
So it can, as I told you, it can start even from 35, 40s as well, as early as that. And it can go on with some people up to 80s. You can't even, my oldest patient is 75 at the moment. So it depends on when you want to stop because a female can have estrogen for as long as you want to and as long as the body needs it. But
Yeah.
again, without having the side effects of the particular medication. So it's still an external agent going into your body. So after the age of your body is entitled to estrogen until 51. And after that, whether your body needs it or not, you'll have to come off the medication and see whether you need it and then decide whether you want to progress with it.
Oh, right. Okay. Now, how does one lifestyle help in managing the symptoms of menopause?
So again, you have to be careful about what you eat because it does have a lot of contribution towards your symptoms. And
Okay.
exercise, sleeping well, eating healthy, again
Mm.
maintaining a healthy diet, and water again is very important. So because
Okay.
during menopause, there's a lot of changes which happens in your body.
Mm.
So estrogen decreases, there's progesterone estrogen imbalance, the testosterone decreases at the same time. So all of this, you need to know the body has got receptors for all three of them. So when they
Right.
go down, it gives you a lot of symptoms like tiredness. Some people cannot remember anything. Brain fog is a big thing during menopause. So you cannot remember what you were doing just about a minute before as well. So it can be quite um, uh, disabling for lots of people. Yes.
All right. Okay. Now, uh, I was reading about hormonal contraception and menopause.
Mhm.
Like, in what way does hormonal contraception play in determining menopause onset? Does it have any correlation at all?
It really, I mean, there is a little bit when you approach the menopausal, perimenopausal period. If you're
Mm.
on a combined pill, sometimes that can help you.
Okay.
And because it's trying to give you another hormone on top of your existing hormone, which is trying to decline.
Okay. All
So
right.
that does help you, but it's
Mm.
not going to act as an entire HRT. It can act as a part of HRT. So the amount, the dose a particular person requires is different from
Mm.
a combined pill.
All right.
So
Okay.
it
I
cannot
understand.
act completely like a HRT.
Right. Okay. Now, if we have to proceed towards the treatment aspect of menopause, it's better for our public to know the slightly about the physiology of what exactly is happening regarding the menopause. Can you explain it to our public, please, as to what exactly happens from the hormonal perspective and why this is happening?
Right. Okay. So we're all born with certain, number of follicles in the ovaries, everything basically. And over a period of time, stress contributes, what you eat contributes, how your lifestyle is there contributes, and also your medications contribute towards it,
Okay.
including the contraception as well.
Okay.
So when you approach a certain age, especially in genetics as well, in your parents and everything. So if your mother has gone through menopause early, then you need to look for these symptoms early on. So
Okay.
during the perimenopause is where I told you the estrogen, progesterone, and testosterone they decline. Okay,
Okay.
so it is a very slow process. Whether it happens very quick, that means you'll go into postmenopause quicker. So, or
Mm.
some people will have ups and downs. Okay, so even your peripheral fat in your body can convert to estrogen. So
Okay.
when these are happening, so they do contribute to the symptoms which I mentioned, because your body has got receptors all over.
Mm.
So they will find the lack of these and they will respond accordingly.
Mm.
So it's, again, getting the HRT quicker if you
Mm.
need, that is
Okay.
important. But
Okay.
if you're able to cope with your symptoms, it's not too bad. Then you don't really have to jump into HRT.
Sure.
So, yeah, so it depends from one person to the other. So, and the
Okay.
amount of HRT needed is again different from one body to the other.
All right. So it is individualistic rather than we cannot give us a kind of a common kind of a treatment for everybody.
No, no, no. Again, the amount required is different as well. So, from one person to the other.
Okay. Uh, Now you're talking about HRT in menopause. If it is not going to be a complicated one, majority of them will be taking HRT, I guess. But are there risks and benefits of this HRT, and why it is not commonly taken by everybody? Uh,
I think there was a fear before that the HRT causes breast cancer, DVTs, blood clots, and it causes lots of other problems. But then again, there's a lot of research done in this field at the moment, and we know that there's not a lot of side effects when compared to a normal population. So that's why there's a big hype in HRT at the moment. So people have come to know that the side effects are minimal compared to a normal population. So that's the reason why they're jumping into the HRT. And when you know your body needs it and when there's no side effects.
all right. Okay. So it should we tell that it is a myth that HRT can cause breast cancer, or
It's not a myth, it can still cause breast cancer. But
okay?
when compared to a normal population, it
Okay.
is slightly.
So there is
So
no increased risk or anything
there
at
is
all.
a very slight increased risk, but it's not to the extent that they're not. So that's why you have to go and consult your specialist, because that is very important for you to know whether, what kind of breast cancer, what it was, So you have to go into the familial pattern of how the breast cancer and whether it's progesterone receptor dominant or not. So there's quite a lot when it comes to breast cancer. So, and who had it in the past. So, all of these are important for us to know whether you can start or not. But it's not that it won't cause cancer. There is a small risk of it. That's why we say anybody going on to HRT, please examine your breast regularly. And if you're above the age of 50, you'll be having mammograms from NHS.
Yeah, of course. Yeah. Okay, that makes a lot of sense now. Now, in you were mentioning about in one of the symptoms that sex drive will be affected, libido will be affected in the menopause. It's an important symptom. Now, what are the treatments or any alternatives that are available for people who have got reduced libido during this perimenopausal or menopausal symptoms?
So, mainly, I would say testosterone plays a very big role. So
Mm,
when if somebody has started HRT, that
mm,
means, and you still have lack of libido, and it's helped your hot flushes, it's helped your, brain fog, it helps your to function properly with joint aches and everything else. So, but
mm.
then again, the loss of libido is persisting for a longer time. Then we say, please either increase your estrogen dose or
Okay.
move on to our additional testosterone is needed at that point, because testosterone plays a very important role in libido.
Right. Okay. Now, thanks for explaining that. Now, if a patient comes to you for either perimenopausal or menopausal symptoms and you commence them on treatment, how frequently does this HRT needs to be continued as an ongoing process for a period of time? Or in the sense that how long and how frequent should the patient come and visit you as a follow-up?
Okay, so if a patient comes to us, we take a whole detailed history first of all. And if everything is okay, no other contraindications, and the blood pressure is fine and non smoker, we start them on HRT. So once
Okay.
they start HRT, either it's estrogen only HRT, or whether it's estrogen and progesterone only, or whether estrogen, progesterone, and testosterone depends on their history again, whether they've got the womb or whether they've taken off the womb for any other reason in the past. So you have to have a progesterone counteracting the estrogen symptoms when you're taking HRT if you had your womb intact. Okay.
Okay.
So if not, you may not need the progesterone component. So we ask them to, when we start the HRT, we usually start on estrogen and progesterone.
Okay.
And we start the testosterone part later on, okay, depending on the symptoms. So we ask them to monitor the symptoms for the first 3 months, and it takes time for your body to get adjusted to the new hormone which is going into you. So we just observe in the first month if there's no side effects of it. And if they're okay, then they can continue it. And we see them back in 3 months. And after 3 months, we have to examine again all the blood pressure, everything else. And then, depending on how they're doing, we either increase the dose of estrogen or how they're taking the progesterone. So, because there's different kinds of HRT. So, there's patches, there's pills, there is injections, and again, there's gel form. So again, we need to know what type of HRT suits that person. So, and then we ask them to come back at the end of a year to make sure that they're kind of okay and they're getting on with the HRT well. So a yearly monitoring is a must after that.
Right. So yearly after that. Okay. Now, we were talking and you were giving insights about HRT. Now, apart from the hormonal therapy, are there any kind of a complementary therapy, any alternative therapies that you advise or recommend or give advice to your patients? Are there anything there at all?
Yes, there is. I mean, there's loads of medications that you can get over the counter. But remember, it's a plant source. There's not been a lot of studies done on the plant sources. So
Okay.
blackwash or, soya or any of these for that matter, they do not have a proper study done. So we cannot say how much you're consuming and how much gets into your body, whether that's giving you a side effect or it's giving you a long-term problem in the future. It's very difficult for us to mention. But the commonly used ones are there's blackwash, there's evening primrose oil, which can help a little bit. It can be vitamin B6, and there's quite a lot of other ones on the market, so which can help as well, but nobody has studied about them.
All right.
So, but again, normal increasing in soya diet, which can have a natural estrogen in them. So,
Yeah.
and making sure you stop smoking, regular exercise, and maintaining the BMI plays a very important role as well, because obesity leads on to the problems of menopause more further.
All right. Okay. So the complementary therapies are not a treatment for the underlying physiological process, rather, they are a complementary for the symptoms of what the patients are undergoing. Is that right?
Yes,
Or am I?
it's almost, yeah, there. Yeah.
Okay. Now, when I was reading about and researching in order to ask you some questions, I came across something called as a bioidentical hormone. Is that right? Uh,
Yes.
what are these, and is it a safe alternative to the HRT?
So remember, there's something called as bioidentical and body identical HRT. Okay. So bioidentical is like something which mimics in your body. Okay. So the body identical ones, there needs to be a lot more studies done on it. So there's something which, so there's micronized progesterones. These are again bioidentical. So there's something which is produced, it's almost imitating what is in your body. Okay, so the other part you have to wait for the research still.
All
There's
right.
they say it's okay, but it's a very controversial topic, so I don't want to get into that at all. So
Absolutely. Let's keep it simple for the time being, and that would be useful. Right. Okay. Uh, Soumya, that has been great. It was sharp, crisp, and you was up to the point, and I really thank you for giving this insights. Is there anything in specific, apart from whatever we are going to cover in the form of the hot flushes symptoms in specific and HRT in menopause, etc.? Is there is anything that you would want to give or let our viewers know about in menopausal and perimenopausal? Anything at all?
I mean, there's a common misconception that people think they're going through depression and anxiety, and lots of people receive antidepressants for it, but mainly it can be just because of perimenopause symptom. as well. So please take that into note. And if you had symptoms, please consult your doctor to see whether it's definitely depression or perimenopause.
All right. One last question to finish this one off.
Mhm.
What is the advice for the husbands of the wives who suffer from perimenopausal and the menopausal one? Is there any treatment for that actually?
Leave your wife alone. Do what she says. Definitely.
That is a golden rule that applies at any point of time, Soumya. Anyhow, jokes apart. Fantastic. Thanks a lot, Soumya. Much appreciated. And I really look forward to seeing you in the next other topics that we are going to cover. Thank you.
No problem. See you then.
Yeah.